Good afternoon, Bermuda, and welcome to the Ministry of Education's press conference. I am joined by the Minister of Education, the Honorable Diallo Rebane, and I'm going to hand it to the Minister so that he can share with you today.
Thank you, Alicia. Good day and welcome, Bermuda. I wish to update the public on the plans to transition our public schools from remote learning to in-person instruction. In September, based on the data received at that time, the decision to start school via remote was made. This decision was not made lightly, as we have repeatedly acknowledged that in-person learning is best for our students. Since beginning the school year remotely, we have not stopped looking for ways to return to in-person learning, but we are constantly balancing that desire with the safety and health of our students and staff. To safely return to in-person learning, we are employing a phased approach for the return to school that considers COVID-19 guidelines and recommendations from the Ministry of Health and assess data such as coronavirus testing results, saliva screening program consent, and staffing ability. At present, the Ministry of Health has recommended that we return to in-person learning, that when we return to in-person learning, we do so under phase 1 of the COVID-19 return to school guidelines. As all parents and guardians should be aware, the saliva screening program was implemented during the last academic year as an additional layer of protection for our students and staff. More recently, antigen lateral testing has been introduced to Bermuda, and the ministry is looking into how this tool can be possibly used as an additional screening tool. However, it is imperative that everyone is reminded that both saliva screening and antigen lateral testing are additional layers of protection. They are not substitutes for health guidelines such as mask wearing, physical distancing, hand sanitizing, and other protection measures like staying at home when you are sick. We will continue with these basic health guidelines while consistently employing additional layers of protection as they are developed. The ongoing saliva screening process is critical because it enables us to identify asymptomatic individuals. It is universally acknowledged that identifying an individual at this stage is much more beneficial than identifying after they become symptomatic. Much discussion and misinformation floated in the community about the saliva screening program, and we feel this is contributing to the hesitancy of parents and staff to consent. However, for absolute clarity, the screening program will administer COVID PCR tests using several methods as follows. Buccal swab method. This is a swab of the mouth and is typically used for younger students and students with special needs. Saliva collection, which involves the spitting in a tube, either self-administered or with assistance. This method is the least invasive method and can be used by most students and staff members. The nasal swab method, which involves collection via nasal swab. This method can be used on any student or staff member. However, to date, we have not received any requests for students or staff to receive a nasal swab, and therefore will be offering saliva collection until someone specifically requests a nasal swab. Bermuda, we have worked diligently to look at practical and easy to adhere methods to get our students and staff into our schools. We are tasked with working with a wide variety of stakeholders and campuses. We have 10 preschools, 18 primary schools, 4 middle schools, 2 senior schools, 1 special school, and 1 alternative program. Our circumstances are very unique. Our plan to reopen has to consider the safety of all and is phased to consider schools that have reached important benchmarks first, while we continue to work with the rest of our schools. We previously announced that the level of saliva screening consent at a school is one of the determining factors. It has been identified as a critical factor in order to ensure safety and health of students and staff. Based on the advice that we have given, a minimum of 80% of consent is required by each school for the screening to be considered as an effective layer of protection for students and staff. I am pleased to advise that multiple schools are over or near this consent level, and this is excellent news. For those parents, guardians, and staff members who have not consented, we urge you to do so, because first and foremost, We all must be reminded that protecting our staff and students and the community at large is all of our responsibility. While we understand that there is hesitancy around positive tests and quarantine measures, our human responsibility is not to put others at risk. To register for saliva screening, you can click on the link at the top of the gov.bn webpage that says Saliva Screening Consent Form. We encourage all employers to recognize that we are still navigating a global pandemic, and your staff members need your empathy and support during these unprecedented times. Suppose your staff members are parents or guardians and are required to quarantine. In that case, we urge you to support them through this process so they are not forced to decide between refusing to have their children tested and potentially having them infect others and financially sustaining their household. Additionally, parents and guardians, where possible, build a network of support, a village, to support you as needed through these times, as coronavirus is here with us to stay. And navigating these uncertain times requires support. While your child may be asymptomatic, and in your mind they're not sick, they do not need to be tested, I strongly urge you to recognize that asymptomatic positives are still a threat to others. You do not know who your child is interacting with in school who may become sick or also become asymptomatic and go home and infect a loved one who is perhaps immunocompromised, struggling with a medical condition, unable to be vaccinated, and in turn, your child is the root of a negative consequence for them. Empathy and human decency is required now more than ever. Additionally, the longer the 80% consent threshold is not reached for a school, the longer it will take for that school to return to in-person learning. Other data that will be assessed for school reopening is the percentage of students and staff that test negative prior to the planned return to school. Testing will be scheduled and school populations will be required to test before returning to school. At least 80% of the school population has to have a negative result before school can reopen. Failure for 80% of the school population to test negative will result in continued remote learning for that school. All staff and all students will be required to test negative to return to the school building. However, those students who do not participate in testing will receive work packets and continue to work from home until they provide a negative test to return to the school in person. As I mentioned earlier, the use of antigen lateral testing is being explored as an additional screening tool. However, this method will not be considered for the negative return to school test result, as a PCR test result will be required. We will begin pre-return testing on Monday, October 4th, hoping to see phased reopenings beginning the week of October 11th, if not sooner. Our intention is to begin with our most vulnerable students at Dame Marjorie Bean Hope Academy, our alternative programs, and other special schools, and then move on to our preschools and so forth. Testing will be specifically arranged for individual schools, and there will be student and staff lists at the test sites to ensure that only those scheduled are tested. There will be strict controls on testing, and the school list on sites will be cross-referenced. If your school has not been contacted, please do not show up hoping to be tested, as you will be turned away. The aim is to return to in-school learning as safely as possible and as quickly as possible. We will know that this is just what our parents, guardians, staff, and students want, but especially what our students need. Just as this pandemic is taking a toll on adults, we must remember that our children are also impacted. They are not immune to the anxiety and frustration the pandemic has brought upon us, even if they may not be able to verbalize what they are feeling or experiencing. The Ministry of Education and the Department of Education and the Ministry of Health have done all we can to provide a pathway for our schools to reopen in the safest manner possible. We are now leaning on our parents, our guardians, and our staff to play their part by showing up for the pre-return testing, consenting to the saliva screening program, and supporting all the layers of protection in place to keep everyone safe. I know we have regularly touched on the aspect of learning. However, I also want to share with you that our students have continued to receive services from school counselors and specialists during remote learning. Our counselors have provided support to parents and guardians who have reached out to them. They support families by regularly checking in with students via individual Zoom and telephone sessions, delivering lessons on positive and appropriate coping strategies, providing parenting tips, making referrals for community resources to assist families, and visiting homes as needed. Counselors hold virtual office hours, and parents and guardians and students have been encouraged to arrange a meeting if needed. They are also responding to teacher concerns about students. In some cases, they have been consulting with teachers about students who are not signing on for remote learning and have joined online classes to observe student engagement during remote lessons. This week, our hardworking counselors are preparing for activities for Mental Health Awareness Week, which takes place from October 3rd to October 10th. As I've said on countless times, we all have a role to play in ensuring our students are supported and prepared to be the shining stars of Bermuda, of the future. Bermuda, let's band together to get our children back to where they belong, and that is inside of our schools. Thank you.
Thank you, Minister. At this time, we're going to go to the media for questions. We have Sarah Legan from the Royal Gazette. Okay, Sarah, so when your audio finished connecting, you are live and you can proceed with your questions.
Hello?
Hello?
Hi.
Hi.
Good to see you. So yeah, I had a couple of questions in terms of, are you able to give any figures as to how many teachers, staff, students have been affected by COVID, have had COVID? Can you give any statistics?
What I can say, Sarah, is those statistics are actually on the government website of how many school-aged children in terms of or how many persons who are under the age of 18. And when I looked at that earlier today, since the crisis has begun 18 plus months ago, it's approximately around 800 out of the 5,000 plus active cases that have been recorded. In terms of the number of teachers, I cannot give that because the data just states who is the age groups of who is tested positive. But we do keep a running total of when teachers are tested positive, because the Department of Health will respond to us and let us know. But I don't have those figures with me at this time.
Okay, all right, thank you. And then you are looking to introduce the lateral flow tests. That's correct?
That it is being explored as we speak. It's something that has only come up this week for us, and it's something that we are looking at.
Okay. So there's nothing more you can add to that in terms of how it could be implemented? I know that Warwick Academy are looking at a program as well. Is there anything similar to what they're doing that you might be considering for public school?
I do know it in our private schools, because I do have frequent dialogue with them. There are some schools that are looking at testing twice a week. I do know there's one school that's looking at testing using lateral flow testing 3 times a week. But I think it's important for all of Bermuda to also understand that this is being done in addition to the saliva screening, and all schools will plan to participate in the saliva screening process that is in place as well. So lateral flow will not replace that; it will become an additional tool. And so we're looking at, obviously, we would be looking at it from a perspective of once a week or twice a week, but it is something that's still being discussed. But again, I stress it's in addition to the saliva testing screening process, not in replacement of.
Is that the case in the private schools as well? It's an additional tool?
Yes.
Yeah.
I've been made to understand they will still participate in the saliva screening, but this will just be an additional tool.
Okay. And did you mention, is it vaccination rates would also help to determine which schools are opening first?
I did not mention vaccination rates. As you know, vaccination is a personal decision. While I do encourage persons to get vaccinated, the science is clear that vaccination is the best possible way of mitigating the effects of this disease. And we do encourage persons to talk to their medical professional and get advice and hopefully get vaccinated. But I only spoke about the consent, the percentage of consent for the screening process that needs to be in place. I did not speak about vaccinations.
And that's not something you're considering in terms of, the students that might be old enough to get vaccinated. That's not being considered as a critical factor as to who would open for. As I said, we are pushing is, if you can get vaccinated, to consider it, to go and get it done. Talk to your medical professionals. But where vaccinations come into play, Sarah, is if there is a positive case, that will be the Department of Health will take that into account in terms of how much, if you are considered a close contact, how much time you would be required to quarantine. So it is taken into account of the mitigation factor. It is taken into account if you are deemed a close contact. Can you share with us which schools are okay to be opened or can get the go-ahead already? You mentioned some have already reached that benchmark.
I actually do not have the figures with me. We did publish them a few weeks ago, and I'm currently waiting for an update of those figures. As you can imagine, since we did publish them, there have been more persons signing up, and so we're just waiting. I'm just waiting for that to be tabulated, and we will obviously release that as we released it before. But I do know that the schools, there's a mechanism in place so the schools can constantly see who is signing up and who's not, because we're encouraging schools to reach out personally to parents who have not signed up, to remind them that it is a possibility there, that they can do that.
Okay, great, thank you. In terms of transportation, are you confident that the transportation is going to be ready for in-person learning? We've heard of some bus cancellations. Is that the case? Is there anything you can fill me in on in terms of school transportation?
We are confident with the transportation for school buses. We actually, in our discussion on Wednesday, DPT was represented, and they are just waiting. What they're waiting for is us to give them a schedule of schools and when we anticipate them returning, and they will act upon the schedules that they receive.
Okay. There's just one final question about Warwick Academy again. We're hearing about a pilot program at Warwick Academy. Excuse me one second. Is it the case that the government's allowing Warwick Academy to do daily testing for exposed students instead of quarantine as part of a pilot program? When it comes to the mitigation of COVID within our system, we have, the Department of Health has reduced the COVID-19 return to school guidelines. And what we do encourage our various school bodies to do is that is the baseline of what needs to happen. And if they have strategies that go above and beyond that, they are free to employ their strategies. And so Warwick Academy, I know, has been very, very keen to employ various different strategies in an enhancement of what's already in place, which would be the guidelines, whether it be mask wearing, social distancing, hand sanitizing, and the various bits and pieces there, the saliva screening process, and in this case, the lateral flow. But if there's anything else that they can do to enhance, schools are encouraged to do what is best for their population. Okay, all right, that's my questions.
Thank you. Thank you, Island Girl.
It's not saying Island Girl again, is it? All right, thank you.
Thank you, Sarah.
Thank you. Take care.
Okay, so that was the only media representative that responded today. So at this time, we are going to conclude the press conference. Did you have any last remarks that you wanted to share, Minister?
Yes, I just wanted to share with our school population, take heart to what we did mention. The signing up for the saliva screening, it's probably the most non-invasive method of, as we said, spitting in a tube, and most of our students seem to enjoy that method more than anything else as we move forward. everything that we've said, everything that we want to do is to return to school, but return to school in the safest possible manner. Everything that we're putting in place is additional safeguards to get us to where we want to be, and that is in school in a safe manner. So if you have not consented to the saliva screening and you still have any questions, please refrain from taking to social media to just ask. Contact us at the department, contact us at the ministry, contact your school, and they will be able to answer any of questions. I do recognize that there is a lot of misconceptions out there, where the test results go, how will the testing be done, and all of these sorts of things. We can answer those questions. I want to assure our parents that the only people who get the individual results are the parents themselves. The only thing the department gets and the school gets is a sign that says nobody tested positive, or there was a negative result. The Department of Health will contact you with further instructions. We do not know what those results are, but what we do know is how many people tested versus how many people should have, and that's how we'll be able to ascertain if 80% tested, if 80% showed up. I just want to encourage people again. The vaccination has been medically proven, scientifically proven as the best way to protect yourself against this virus, in addition to other measures. If you are eligible for vaccination, please consider it. Talk to your medical professionals, get the advice, and go and get the shot if this is what you intend to do. Please, Bermuda, help us to keep our country safe. Help us to open our schools.
So I'm just reading the comments on Facebook, and it's a lot of parents that we're expecting a definite date for return to in-person learning. So I just want to reiterate what was said, that the 80% of saliva screening consent is being considered, as well as the negative 80% at least to test to return, but that students will have to provide a negative test result. Naturally, the information will come from the schools to parents. So the schools that are at the 80% threshold that we released, they will be contacted with a schedule. You will be given the schedule in advance. Some parents have also asked about taking their children to their doctors to get tested. You will have a schedule, so you will know when you need to provide that test. So it is an option to take them personally to their doctors, but we will communicate it through the schools. It's impossible to give all of that direct information via a press conference to the country. So just wanted to reiterate those key points. But as always, as the minister just said, if you have direct questions, please contact your school family so that they can answer you directly. And minister, if you just want to let them know an email address that they can perhaps send general questions to.
General questions, you can send them. You could actually, all parents know how to contact their schools, and I always encourage them, as that is the first place that you go. Contact your school administrators, and they will be able to answer those questions for you. And if they cannot answer those questions, they can ratchet it up to the appropriate person to actually get you that information. I understand what you just said, Alicia, Ms. Trott, that all the people were looking for definitive dates, but this is not one of those things where we need to rush to get to where we want to get to. We've outlined what needs to be in place in order for a school to return. And we've done, as I said in my comments, that the Ministry of Education, the Department of Education, the Department of Health, the Ministry of Health, we've done everything that we can do to get us to that point. The next step is on our parents and our staff to follow through, sign up for the saliva testing. When your school is called up, go get your testing, so we know what your status is, and so we can open the school. And the definitive dates will be announced once we have that information. So when we announce next week, your school is ready for testing, and only 10% of the people show up, we can't announce a opening date. It's as simple as that. I cannot make it any simpler than that. It makes zero sense for us to reopen a school and not know the status of everyone walking through that door on day one, and end up with a school closed 2 days later with persons who weren't on quarantine now on quarantine. That just doesn't make any sense.
Agreed. And thank you to the MDL Layup for their assistance with helping us with testing. We know that they have been completely swamped for a while now, and they are helping us to arrange our testing. So just want to say thank you to them for working with us. But that is going to conclude our press conference for today. More information will be forthcoming to parents. And have a good day, Bermuda.
Thank you. Have a good day, Bermuda.